I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Most of us ignore our feet until they start to hurt. A lot of things can go wrong, from heel spurs to plantar fasciitis. This is the People's Pharmacy with Terry and Joe Graydon.
Foot problems are surprisingly common. Do you have bunions or hammer toes that make it hard to find shoes that fit well?
A sprained ankle or Achilles tendonitis can really slow you down or even keep you off the pickleball court or hiking trail. How can you promote healing?
Our guest, Dr. Jane Andersen, will answer your questions about what to do for foot and ankle problems.
Coming up on the People's Pharmacy, learn how to fix your foot pain.
In the People's Pharmacy Health Headlines, a different variety of bird flu has just been detected in Mississippi. This strain, labeled H7N9, was first detected in China in 2013. It has not been seen in this country since 2017, but now it's appeared on a commercial poultry farm. The previous outbreak of this strain killed 39% of the humans infected with it. A different strain of avian influenza, H5N1, has been spreading not only to domestic poultry, but also to cattle, cats, and wildlife. Although one person has died from complications of H5N1 infection, that type of bird flu does not appear to be quite as deadly to humans. It has raised egg prices, which are likely to rise further if more flocks are affected and need to be destroyed.
A month ago, the FDA was hit with large reductions in force. Even though about half of the agency's budget now comes from user fees paid by the pharmaceutical industry, probationary employees were dismissed. Food safety staff and workers in medical device oversight were especially hard hit. Thousands of FDA employees returned to work this week. Many of the workers who had been fired were reinstated. They found chaos because parking lots were filled over capacity while offices were scrambled and under-equipped. Many FDA employees had to scrounge chairs, desks, and computers.
In general, doctors tell us that what's good for the heart is also good for the brain. A study published in the American Journal of Clinical Nutrition supports that view. People who cleaned up their act after a diagnosis of cardiovascular disease were less susceptible to developing dementia. Researchers analyzed data from the UK Biobank, including 77,000 or so participants who had cardiovascular disease but not dementia at the start of the study. Over 12 years, those who adopted healthy lifestyle practices were only half as likely to develop any sort of dementia. They were 20% less prone to Alzheimer's disease and 70% less susceptible to vascular dementia than people who did not practice lifestyle improvements. These consisted of no current smoking, no more than moderate alcohol consumption, regular physical activity, a healthy diet rich in vegetables, fruits, whole grains, and fish, adequate sleep, frequent social contact, and limited sedentary behavior. Those with healthy lifestyles had lower levels of inflammatory markers in their blood, as well as lower levels of LDL cholesterol and apolipoprotein A. The investigators hypothesized that this might help explain the benefits of lifestyle changes.
When most people experience acute pain, they reach for an analgesic such as aspirin, ibuprofen, or naproxen. Researchers at the University of Vienna might suggest adding a dose of nature. That's because their research team examined the effect of nature-based therapies on the experience of acute pain. Researchers administered electric shocks to the back of the left hand of volunteers while they were undergoing functional MRI scans of the brain. At the same time, the participants viewed three different types of scenes. One natural setting showed a beautiful body of water surrounded by trees, another was of a city skyline, and a third was of an indoor scene of an office with a desk and a computer. The volunteers rated how painful the shock was. Those observing the natural settings rated their pain as less intense and less unpleasant. Brain imaging confirmed less activation in pain processing centers while volunteers watched the natural scenes. The authors point out that their study confirms 40-year-old findings that surgical patients recovered more quickly and needed fewer pain pills if the window of their hospital room looked out on trees compared to a brick wall.
Rosemary has been linked to better memory for centuries. Now scientists have found the responsible compound. Carnosic acid activates the body's defenses against inflammation. When given to mice, they recovered their memories and had decreased brain inflammation. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon. I'm a medical anthropologist.
And I'm Joe Graydon. I'm a pharmacologist. You know, humans are pretty good at ignoring health problems, whether it's high blood pressure, prediabetes, or heart disease. Terry, these conditions may be doing damage, but they often go unrecognized for years. When something hurts, though, it's really hard to ignore, and that's especially true for your feet. It's hard to walk when your feet hurt.
Oh, that's certainly true. Today on the People's Pharmacy, we'll be discussing how to fix your foot pain. Do you have questions about a foot problem, such as plantar fasciitis or bunions?
We invite you to join the conversation. Our lines are open. 888-472-3366. You can email us your questions and share your story at radio@peoplespharmacy.com. Do you have high arches or flat feet like me? Have you ever suffered from corns or calluses? Call in your questions, 888-472-3366.
We're delighted that the People's Pharmacy podiatrist, Dr. Jane Andersen, is joining us today to answer your questions. She's in practice at Chapel Hill Foot and Ankle, part of FASMA, Foot and Ankle Specialists of the Mid-Atlantic. Dr. Andersen specializes in foot and ankle care for children, adults, athletes, and geriatric patients, including surgery and conservative care. She is a trustee of the American Podiatric Medical Association. On January 18, 2025, Dr. Jane Andersen was awarded the Edwin B. Martin Jr. Award for Podiatrist of the Year. Welcome back to the People's Pharmacy, Dr. Andersen, and congratulations.
Thank you so much, and thanks for having me back.
We love having you here, and we know that our listeners love asking you questions. Again, that number, if you have foot pain or any other kind of foot problem that you'd like to talk to Dr. Andersen about, our lines are open, 888-472-3366. And I guess my first question, Dr. Andersen, is why do I have flat feet, flat as pancakes, while Terry has high arches? Is this genetics? Is it bad shoes? Something else?
It doesn't seem possible it could be bad shoes because your mother was very conscientious about making sure you had shoes that provided good foot support when you were little.
Yeah, they were so ugly. Unbelievable.
My parents also insisted on sensible shoes, tie-up Oxfords with ties.
Yes, it really is a genetic thing. Just like our faces look like our parents, our feet look like our parents to a certain degree. And I always joke with my kids, you wish that you could choose what you give your kids when you pass on your genes. And
you do wish that, and they probably wish it too.
Right. But definitely, I think that the funny thing about this is really high arch feet sometimes are a lot more problematic than flat feet. Feet can become flatter as people age, and they can also become flatter with actual tendon problems. So if you didn't have a flat foot and then it becomes flatter, that's something alarming. You should see your podiatrist about that.
And what can you do about flat feet? I mean, I do wear Birkenstocks because they kind of give me some support, but I've tried all kinds of shoe inserts, but it's sort of frustrating, especially when I take my shoes off.
Yeah, sometimes it really does focus around what you're wearing and what you put inside your shoe. There is something called an orthotic, which is a custom made prescription device that, the podiatrist can scan your foot and send it to the lab and make something specifically for you. That is something that may provide you with a little bit more relief than just the over the counter devices. The hard part is that you can't completely correct that flat foot. Sometimes just a little bit of an arch is better than no arch, but you don't want to try and put it into a quote normal foot position because you would never tolerate that.
It would be too
Too
uncomfortable.
much. Yep.
Let's go to the phones and talk to Penny in St. Petersburg, Florida. Penny, welcome to the People's Pharmacy. Tell us your question.
Hello, good morning. Yeah, I'm wondering what I could do to alleviate peripheral neuropathy in my feet.
Peripheral neuropathy, what does it feel like, Penny?
And I'm missing tingling.
Yes, so peripheral neuropathy is a tough one. First of all, you want to make sure that you figure out if there are any treatable causes why you have neuropathy. The most common are diabetes, alcohol use, vitamin deficiencies. And some people just have what we call idiopathic neuropathy, meaning we don't know why you have it. And it can be very uncomfortable and very disturbing. There's no cure for neuropathy. First, you want to control any contributing factors, but there are some supplements that I sometimes prescribe. There's something called alpha lipoic acid, which people take usually about 600 milligrams a day. And sometimes after a few months of doing that, you'll experience fewer symptoms. But there's no magic bullet here. So that's something that a lot of people do try and do benefit from, though.
Thanks for that call, Penny. And we have email, Joe. We have an email from Lou who says, I'm interested in exercises or other things that can be done to alleviate plantar fasciitis. It's been bothering me about 7 months. I've been doing some calf stretches by leaning against a wall and an exercise to strengthen my arches by gripping a plastic bag with my toes. The condition is improving, but it hasn't gone away.
So we always get questions about plantar fasciitis when you're here, Dr. Anderson. What exactly is it? How does it happen? What can we do to prevent it from happening? And then let's deal with this particular question from Lou.
So it's a very common deformity. We see it daily in the office. It manifests, it's an inflammation of a band of tissue on the bottom of your foot. And the tissue goes from your heel bone to the ball of your foot, and it's like a thick ligamentous structure. And its job is to help support your arch. And typically speaking, the first signs of plantar fasciitis are when you first stand up in the morning and your heel hurts. Sometimes it's your arch. But when you notice that, that's the time to see your podiatrist as opposed to waiting 7 months. So just a little word for word to the wise of the people out there who are experiencing that morning pain, because it can get to the point where it bothers you all day long. The reason it bothers you when you first stand up is if you can imagine when you're laying in bed, your arch is relaxed and then you stand up and your foot stretches and that fascia pulls. So a lot of people in the beginning stages will find that it hurts when they first stand up and then they walk for a few minutes and it goes away. It's exceedingly common and it can be tough to get rid of. Stretching is great. I'm glad you're doing that. I usually tell people to stretch at least 3 times a day, to hold your stretch for a long period of time.
Explain
Now,
the
what
stretch.
kind of stretch?
So there are a lot of different exercises that you can do. I think the most important is what we call the gastrocnemius stretch, which is like the runner stretch when you lean against the wall. Your back leg is straight, your front leg is bent, and you're stretching your back calf. If you do that, you hold it for 30 seconds, switch to your other leg, and then repeat. I tell people to do that 2-minute sequence 3 times a day, but that's not the only thing you're going to need at this stage of the games. Maybe that's when, when it's really early on that can nip it in the bud. There are a lot of treatment options, orthotics or over-the-counter arch supports. Make sure your shoes are in good shape. Icing, massage. Then we throw other things at it, sometimes cortisone injections, sometimes anti-inflammatories, physical therapy. There's any number of things. You want to make sure you've got the right diagnosis first, which maybe it is. But at the same time, there are a lot of other treatments at that point. Like I said, exceedingly common. The best way to prevent it is to, number one, make sure you're replacing your shoes frequently. Avoid walking barefoot too much. We see a big uptick in the late fall or the early fall after summer times when people are wearing like than unsupported flip-flops.
Flip-flops.
Yeah. So, and there are flip-flops out there with support. So
Yeah, you've shared that with us in the past. What are the brands of the quote unquote good, safe flip-flops?
So there are several. One good resource for the listeners is apma.org. There's which is the American Podiatric Medical Association. They have a SEAL program. So the SEAL talks about shoes that have been tested by podiatrists and have the extra support you might need. Some of the brands that I like, Vionic, which is a SEAL holder, Atrax, Allegria, Dansko, even FitFlop is a good brand. Chaco is a great brand of sandals. So those are all good sandals out there for.
And is it that they have support? What makes them good?
Usually they have a little bit of arch support built in. There's a brand of recovery sandals that make flip-flops called UFOs that I sell in my office that I really like. They're wonderful for people with plantar fasciitis to use as house slippers. So.
Now, a lot of people are buying shoes online these days. And, when I was a kid, I would find a pair of shoes that I really liked. They looked really cool. And I walk around in the shoe store and they felt okay. And then I get home and I'd wear them for a week or two. And then I have blisters and they'd hurt and you can take them back. How can you buy shoes online? I know you can probably return them, but is there a safe way to do that?
It's really hard to do that effectively unless you really know what you wear. So in the case of running shoes, I usually encourage my patients to go to a full service running shoe store and be fit appropriately the first time at least, and then to continue because sometimes the models of the shoes will change, which is super frustrating for everyone. But it is important to be fit appropriately, especially if you're using them for sports. So that's one of the things. I find a harder people in the wrong shoes more frequently when they've bought them online. Let's put it that way.
Okay. We
are coming up on a break. So go ahead, Joe.
Our lines are open. What's the number, Terry?
The number is 888-472-3366. And if the lines are full, you can send us email, radio@peoplespharmacy.com.
After the break, we'll talk about, whatever you want to talk about with your feet. Hammer toes, ingrown toenails.
Is there a connection between athlete's foot and toenail fungus? In any event, they're both fungi, and we'll find out what to do about them.
Our lines are open, 888-472-3366. You can email us, radio@peoplespharmacy.com. Share your story about toenail fungus.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Today, we're talking about how to fix your foot pain. Our guest here in the studio is Dr. Jane Andersen, a board-certified podiatrist in practice at Chapel Hill Foot and Ankle Care. She's a trustee of the American Podiatric Medical Association. On January 18, 2025, Dr. Jane Andersen was awarded the Edwin B. Martin Jr. Award for, get ready, Podiatrist of the Year.
Dr. Andersen, what is a podiatrist?
So, a podiatrist is a doctor of podiatric medicine. We treat foot and ankle deformities exclusively. So, most doctors kind of treat a system like a cardiologist treats your cardiovascular system, a neurologist treats your nervous system. We treat geographically below the knee and the foot and ankle structures associated with them. We do surgery, we prescribe medicine, we do a lot of conservative care too. To become a podiatrist, you have to do your undergraduate medicine, pre-med sort of things, like,
Okay.
all the typical things. And then you attend a podiatric medical school, which is very similar to an allopathic medical school. It's 4 years in length. We just add a few extra subjects that are not covered, like
Toes.
feet, foot surgery, things like that, biomechanics, how the foot functions. And then every podiatrist now does a 3-year surgical residency. So there are podiatrists out there that aren't doing surgery, which is fine, and that's a choice, but everyone is trained to do surgery at this point.
Okay. Well, thank you for letting us know. And I think, Joe, we have somebody on the line. Let's go back to the phones and talk to Rick in Tampa, Florida. Rick, your question, please.
Hello, Rick.
Hello?
Yes, go ahead.
Hello. Yes, I just wanted to say many years ago I would say plantar fasciitis, bad pain in my heel, and I had purchased in the store a pair of very expensive shoes that were supposedly orthotically designed for healthy feet, blah, blah, blah. When I went to a podiatrist, the podiatrist said to me, "Oh, you're in," and I won't mention the brand, but this particular brand of a shoe, and they said, "Get out of that and get in some nice, comfortable tennis shoes." And I'm like, "But these shoes, the ones I bought, are supposed to be, very good." Anyways, he said, "No, do that." I did that, followed his advice, and the bottom line is my pain eventually disappeared, and I've not had any issues ever since. And so I'm very glad to hear your guest today talk about the importance of what you wear. And again, just because it supposedly is even designed really well, I think going to a qualified health professional like a podiatrist, and they say shift into something else, try something else, and that may help like it did with me and eliminate my foot pain. I've never had any heel pain since.
Well, thank you very much for the call, Rick. Well, there you have it, a little plug for podiatry.
Yeah, I mean, it really makes sense. And, when I see a patient, the first thing I'm doing when they have some sort of musculoskeletal pain is, what kind of shoes are they wearing? Are they wearing the wrong shoes? And sometimes it could be a very high quality shoe that is actually the wrong shoe for that person based on their foot type. So with your, Terry, with your high arch feet, I would never put you in a shoe with motion control because that would shift the weight of your foot out to the outside of your foot, and that would create too much pressure there. So you'd want a neutral shoe. But some people think, oh, I have plantar fasciitis, I need a shoe with support. It may not be right for you.
I've got a question for Millie in Blacksburg, Virginia. I've had pain in my right foot for almost 30 years after an injury that was not treated other than a determination that no bones had been broken. I bet you hear that a whole bunch. The pain is sometimes just discomfort and sometimes more acute, but it's always there. Is it possible that it could be improved after so many years? And if so, should I look for a podiatrist or a foot surgeon? Well, podiatrists are foot surgeons.
Exactly. So, yes. So I don't know with, specifically in this case what it is, but a similar scenario might be you have an injury to a joint where the cartilage is damaged. You can't see that on x-ray necessarily in the beginning. And over time, you might develop significant arthritis in a joint, and that can be very painful. And certainly that could be treated surgically or non-surgically by a podiatrist. And yes, that would be a great resource for her.
Excellent. And if you would like to talk with our guest, Dr. Jane Andersen, you can do so by calling 888-472-3366. And now we go to Penelope in Raleigh, North Carolina. Penelope, your question, please.
Hi there. Yes, I have something I gather is called cross toe on my right foot. It's developed over the last year or so, where my second toe is crowding my big toe. And it's not painful. It's just a little annoying for them to be kind of sticking together too much.
Sometimes those toes can be really stubborn, those second toes that cross over the big toes, and it makes it difficult to wear a shoe. So conservatively, we recommend a deep shoe we recommend, sometimes I'll have people tape their toe down or pat it, a soft shoe or stretching a shoe on top. Like I often recommend those old school like wooden shoe stretchers that you can stretch your shoe out to keep them at your house. Um, but there are surgeries we can do to straighten those things out if that's acceptable. You may not need it. If you can manage it, that's fine.
The last time you were here, Dr. Anderson, you actually looked at my second toe, which is actually quite a bit longer than my big toe, and you taught me how to tape it so that it doesn't cross over. That works.
Excellent.
And it really makes life easy. I'm going to go to in another email because our lines are full. Tara Evans in Tampa, Florida says, I periodically get cramps in the arches of my feet. I wear sensible shoes, use the electric massager, or roll my feet over tennis balls. I take magnesium. What else can I do, Dr. Anderson?
Well, if it really is a cramp, like actual muscular cramp, we've talked about that before.
Mhm.
My protocol is, sometimes magnesium, I'll throw that in there, but I usually think that to some degree there's an electrolyte imbalance or fluid imbalance of some sort. So my first level is, okay, add an extra glass of water a day. And if that doesn't change anything, then add a glass of something with electrolyte replacement, like Gatorade or Liquid IV or something along those lines, just to see if that makes any difference, because it just might. I find that I have terrible cramping in my legs in the summertime if I'm out playing sports in North Carolina in the evening and I'm sweating and it's, if I don't take electrolyte replacement, that's when it really flares up for me.
Mhm.
And of course, we have a few home remedies, Terry.
We do have a few home remedies, and I find that usually swallowing a spoonful of yellow mustard takes care of that foot cramp, which often attacks, in the middle of the night, wakes you up, which is very unpleasant.
And of course, a lot of folks say pickle juice, a teaspoonful of that may work. It's the strong flavors.
The
Yes.
apple cider vinegar can also do the job.
Where to next?
We are going to talk to James in Endicott, New York. James, let us know what is troubling your feet.
I'm 73 years old, and I'm not sure if it's an old thing, but my big toe on either foot, when I'm home sitting on the couch or when I'm even sleeping, all of a sudden my toe will swing up real hard, and I try to push it down. It hurts like heck, and I don't know why, but I'll get up and eventually I'll walk around and it'll go away. It doesn't happen in both feet at the same time. It just happens in one or the other. It is very annoying. I just recently found out I was vitamin D deficient, and I've just started a medication for it, and I wondered if it had something to do with that, too.
So what I'm seeing here on the screen, Dr. Anderson, is that James has his big toe pop up when walking. Do you have any idea
Well,
what that is?
It tends to go back down after he's walked a little bit, but when he's resting, it flips up.
So if it's actually like the toe popping up when you're resting, it might just be a muscle spasm like we just talked about,
Yeah.
because that muscle is in the front of your shin.
And vitamin D deficiency could contribute to that, couldn't it?
Possibly. Yeah, possibly. So some of the things we talked about for muscle cramps would be good. If your toe is popping up when you're walking, and it may be related to a weakness of a different muscle. So there are a lot of what we call dorsiflexors, which are muscles that pull your foot up and allow your foot to clear the ground during swing phase of gait, meaning when your foot is, when you're not on that foot, when you're on your other foot. And sometimes when people pull their big toe up too much, it's because their other muscle, their anterior tibial muscle, is not working as well.
I've got an email from Carl in Roanoke, Virginia. He says, I've got old orthotics. And I can relate because I, too, have old orthotics. He says, it's been 10 years, maybe even 20, since I've had my feet checked. My orthotics are in perfect condition. They seem to be working fine. I don't have any I don't have any knee problems. Do I need to get new orthotics?
In my opinion, no. Those are the people I don't want to mess with what's going on. I know in theory, orthotics usually last about 5 years or so. Your feet change a little bit. But if you're not experiencing any symptoms and you're happy with your orthotics, I hesitate to mess with that situation. I say, let's just keep going with those and it seems like you're doing fine.
And Andrea says, I get calluses in the same part of my toe. And when I go to get a pedicure, they take care of the calluses, but they always come back. Is there anything I can do that might be the shoes that I wear? What causes these darn calluses? And Andrea is from Woodbury, Minnesota.
So calluses are a reaction to friction and pressure. So the area where you bear the most weight on your foot is where you're more likely to get a callus on the bottom. So maybe one bone sits down a little further than another. You can get calluses or corns in between your toes when your toes rub together. So sometimes we have people do padding, sometimes an orthotic inside their shoe will shift the weight away from a certain area. But chances are you're going to keep getting the calluses. Now, there are cases where we do foot surgery and correct deformities and calluses go away. It's not always worth foot surgery to fix a callus, but it just depends if that's a particularly painful area for you regardless. So that can be addressed, but I tend to go on the more conservative end of addressing those.
Okay. We're going to talk to Susan in Sarasota, Florida. She has a question about toes. Susan, what's your question?
Yes, I've been diagnosed with
Oh, dear.
ulcerated
Oh, Susan, I'm
toe.
so sorry. The connection is not good. I do apologize. Susan was asking about ulcerated toes. She said she's used spacers, but obviously her phone connection was not working.
So when we're talking about the little corns that come between the toes, certainly those can ulcerate. And there are ulcerate means the skin breaks down and you've got an open sore. And there are different things that are different scenarios where it's more prone to ulcerate. Patient with diabetes, maybe someone who has neuropathy, numbness in their foot, they can't feel that their toes are rubbing together, vascular disease. And obviously in patients like that, those people oftentimes will come in for preventative care, meaning we trim down their corns and calluses so that it doesn't ulcerate. And that's really important to keep them out of trouble. It can happen in people as they get older, or even I've had a few younger people that have happened to. It's important to say if you're getting an ulceration in an area of a corner callus, that's something that probably should be considered to be addressed surgically, right? So that you don't continue to break down that skin and get an infection.
Okay. Let's talk to Linda in Charlottesville, Virginia. Linda, go ahead, please, with your question for Dr. Andersen.
Yes, Dr. Anderson, I'm 81 years old. I have arthritis really bad, but I have extremely bad bunions. It's quite hereditary. And 3 podiatrists have turned me down for surgery because they said the arthritis is so bad and that within months I'd be back in there and they'd be having to fuse bones. And the other problem is...
Linda, I'm sorry. We are having phone difficulties today, but let's see if we can address that first problem, which is the very bad bunions related to arthritis.
What are bunions? Why do we get them? And is there anything that can be done to prevent them or eliminate them once they're a problem?
So bunions are a bump on the side at the base of your big toe. You get this big lump on the side. And it's really not just a bump, it's a shifting of bones. And they are genetic in the sense that just like we talked about before, your feet look like your parent, or your face looks like your parents, your feet are going to look like your parents as well. There are influencing factors like if you wear shoes that are too small or too narrow. Bunions can be addressed surgically. We don't always recommend surgery on someone with bunions because if you've got a lot of foot deformities, maybe fixing the bunion might not be enough. So like in this case, it sounds like she might have more extensive arthritis with deformities at other joints as well. And if you just fix the bunion, it's probably not going to help the rest of the foot.
She said that, and I know this only because of what was written down, that 3 podiatrists had turned her down for surgery on the bunion because they said her arthritis was too bad.
And sometimes, you get to the point where managing something conservatively is the better choice. It may be, some people don't have enough blood supply to heal a surgery like that. So as people get older, it becomes a lot harder to heal surgery.
We've got a message from Judith. My big toenail has gone almost flat to high arch. Now,
It started that it was flat, the toenail was almost flat, and now it's curved
Okay.
up.
the side edges dick in when I cut it. No fungus that I can see. Healthy feet otherwise. I don't have a clue what Judith is talking
But
about.
I do because I have a toe that has done the exact same thing. It irritates me no end because it looks like an old person's toe, and it's actually hard to cut the nail because it's gotten thick as it's tented up.
So there are a lot of nail deformities that we see, and ingrown toenails are certainly one of them that, and I'll get back to that in a minute, but there is a deformity where people get something called a pincer nail, where the nail starts flat and it sort of deforms into a curve. Like if you look at the end of it, it's U-shaped almost.
Uh-huh.
And that can be caused by a spur of bone underneath the nail. It's not always a spur. Generally, it's not, but that can contribute. But it creates this sort of ingrown toenail, which is where the nail digs in on the side of the skin. An ingrown toenail can be painful, it can be not painful, and it can be infected or not infected.
Mhm.
And if it's infected, it definitely needs to be addressed. It is not something you want to ignore. I see ingrown toenails every day. We can remove them easily in the office. There are wonderful procedures for that. If you ignore an infection in your ingrown toenail, it can get into your bone.
Ooh,
Oh,
nasty.
That's bad.
Definitely don't want to do that. I assume an infection would hurt.
It does. You'd be surprised at how people's pain tolerance. Sometimes I'm very surprised at how long, people come in all the time. I've had my infection for 6 months, and I think,
Wow.
good grief. But removing a piece of the nail is very important. Even in the patient that's not infected, I had a lady came in. She was probably 50. And she had had these toenails that dug into her skin for years, and she would try and cut them back herself. And she said, I've been digging out my ingrown toenails for 40 years.
Oh, my goodness.
And she said that she saw on TikTok that there was a cure. And so we numbed up her toes on the spot, took out the little slivers permanently, and she was the happiest person around. So
We're talking about your feet today on the People's Pharmacy. Do you have a home remedy for nail fungus? What's worked? What's failed? Share your story. Our lines are open.
They are.
888-472-3366. If you can't get through or if the phone's not working, give us an email. What is it, Terry?
The email is radio@peoplespharmacy.com. And after the break, we'll try to talk about neuromas.
Okay. Give us a call, 888-472-3366. And it's radio@peoplespharmacy.com.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Today, our topic is foot health, and we have an expert right here in the studio to answer your questions. Dr. Jane Andersen practices at Chapel Hill Foot and Ankle Care. She is a trustee of the American Podiatric Medical Association. Earlier this year, she received the Edward B. Martin Jr. Award for Podiatrist of the Year.
And we'd like to know what foot problems have troubled you. You can call us at 888-472-3366. If our lines are full, you can email us, radio@peoplespharmacy.com. And I would love to know what works for nail fungus, because we hear all the time that there are home remedies that make a huge difference. And then other people say that was totally worthless, didn't do a thing, and I needed to take a pretty powerful medication. We do have one question. I don't know if we've ever asked you about this. We probably have. But we read in a journal, Terry, what was it, about 3 or 4 years ago, that neomycin might be helpful because a fair number of nail fungus.
We didn't read that neomycin might be helpful. What we read was a dermatology journal that said bacteria are frequently the cause of an infected nail. And we have been getting reports from our audience, people who've tried neomycin and said, or Neosporin, and said, it made my infected toenail clear up. And we said, oh, well, maybe the infected toenails that clear up in response to Neosporin or even polysporin are bacterial instead of fungal.
That's actually something to consider. It is something now testing has improved for fungal toenails. And I don't always order the most expensive test, but on occasion we do, and that's a PCR test.
Yeah.
And that will identify if there is bacteria. And I do see that periodically and throw in some topical antibacterial, such as, polysporin or something along those lines. It's just a really hard problem no matter what. There are a lot of factors in terms of toenail disease, and, you're inside a shoe all day long, and that doesn't help.
Why do older people seem to develop nail fungus, whereas babies don't get it? Kids don't seem to get it. Teenagers certainly don't. Young adults don't get it.
Even though all those people do get athlete's foot from
Right.
time to time.
So occasionally people do get it when they're younger, but mostly it is when we're older. And it is really just our immune systems can't fight it off at that point, right? So
Aha.
we're
So
just
our immune systems are failing us when we get nail fungus. What about athlete's foot? What are your favorite treatments?
So there are a lot of good treatments for athlete's foot. I think that, over-the-counter Lamisil and Lotrimin, we have a product in our office that is a tolnaftate-based product.
Oh, that's an old one. Tinactin, right?
Yes, but we have a slightly different, sometimes it's the vehicle in which it's delivered, and that makes a big difference. It kind of depends on where on the foot it is. There are a lot of subtleties to athlete's foot infections that I think people don't pay attention to, and one is how you apply the medicine is really important. So the infection typically is on the bottom of the foot and in between the toes. We call it in a moccasin distribution, like you're wearing a moccasin. You should apply the medicine at least 1 inch beyond where the edge of the moccasin is. So
Okay.
if you see the edge of your foot is scaly, go an inch higher than that and, apply the medicine to the bottom of the foot in between the toes. If you are experiencing that white, macerated skin between your toes, that's likely a fungal infection. Make sure that you want to use something that's more drying, so like a gel or a liquid. If you're more cracky and scaly on the bottom of the foot, a creamer, a lotion, creams, ointments, things like that are fine. So there's a lot of, differences. There is also a secondary bacterial infection that people get in between the toes frequently. It's called erythrasma. It's caused by Corynebacterium, and you can only see it with a special blue light in the office. So sometimes I'll screen people, and then those people get treated with an erythromycin, either topically or orally.
Okay, so that's an antibiotic that would take care of the bacteria.
So you can have both a fungal and a bacterial infection in
Absolutely.
your toes. And your favorite brands when it comes to getting rid of athlete's foot? You mentioned a couple. What others?
So like I said, we have a product. The product that we have in our office is fungi foam, and it works really, really well. Prescription, there's a drug that is called Naftin gel that I like for the people that have too much moisture because it dries things out really nicely. One of the big dangers of an athlete's foot infection is it creates microscopic cracks in your skin. And if you, especially a patient with diabetes, is more prone to a bacterial
Right.
infection, that they might end up in the hospital with a cellulitis. So it's really important to treat that skin infection, even though it just looks like athlete's foot scaly skin.
I've got an email from Kathy. She says, how do you treat hammer toes? Mine has become a problem in finding shoes that don't have a stretchy top or sandals with open top. First of all, what are hammer toes? I assume they look like hammers, but what does that mean exactly?
It's really when your toe sort of curls up and it's bent, and oftentimes people have trouble on the tops of their toes with shoes, and sometimes on the ends of their toes if they're hitting the ground. Hammer toes can be flexible, they can be rigid. It just depends on the level of the deformity. It is hard to wear shoes sometimes when you have hammer toes, so it's important to look for something deep or soft, like she said. But also, if you you can stretch your shoes, sometimes wear pads, sometimes you can tape the toe down, like we talked about taping toes down. But it really is, if it gets to the point where it's rigid and you can't wear a shoe, you might need surgery to straighten it out.
We are going to try the phones one more time, Joe, and we're going to try to talk to Mary in Roanoke, Virginia. Mary, welcome to the People's Pharmacy. Let's see if we can hear you.
Okay, thank you. Hello. Can you hear me?
Yes, we can. Thank you.
Okay. I have a question. Mine is, I have a toe that it's almost like two toenails. I mean, it's very hard to see. You can't see it from just looking at it from above, but when you look down, it looks like there's like a sliver of another nail growing. And I didn't know if this is something that really should be addressed. I've had it for years. I wasn't like born with it, but it's just more annoying.
Does it hurt? Does it hurt at all when you wear shoes?
No. If I'm an athlete, and when I get really active, sometimes I might, like from tennis or pickleball, I might push on it and it might kind of split it a little bit.
Mm-hmm.
But so then it might flare up. There might be something, but not like right now. No, I'm not having an issue.
There is a very common thing to happen is like people will have a split fifth toenail. It's sort of a genetic thing. And sometimes that is caused by a little spur of bone underneath the nail. So it's not, unfortunately, if it is that, you can't just remove that little piece of nail. You actually have to like remove the little piece of nail and shape down the bone underneath to get rid of it. But if you can live with it, it's fine. No worries. Usually it's not an issue as long as it's not like a dark streak or pigmented or anything like that. I think you're probably fine.
Thanks for the call, Mary. Let's go where, Terry?
I think you wanted to go to Dallas, Texas, and talk to Oakvie. Is that the right name?
Hi.
Hi.
Yeah, my name is Okezie. I'm calling from Dallas, Texas. I just want to make a comment that about 9 years ago, I experienced pain from plantar fasciitis for the first time. I didn't know what it was. I just felt a bump under my, arch on one of my feet. So I had to visit a hematologist for something that was not related to it. And then I just mentioned it. So I thought it was something that I had to do surgery for. So he said, no, that you didn't need surgery, just change your shoes. He looked at the shoes that was fitting on them. He said they didn't look good. So you just need to get something more comfortable and, see a podiatrist. So I just, made the change, but pretty much low budget runner shoes, which felt comfortable. And, ever since, the pain gradually went away. And one other thing I also did was that I made it a habit to wear, like slip-ons.
We're not able to hear you very well, Oakvie. I apologize for that, but it sounds like his shoes made all the difference for the plantar fasciitis.
Thanks for
suspect
that call.
You've heard that before, Dr. Andersen.
Absolutely, 100%. And like I said before, bad shoes can cause plantar fasciitis. I think one of the big things to keep in mind is replacing your shoes frequently. So if you're a walker or a runner, no more than 500 miles on your shoes. And if you wear those same shoes all day long that you exercise in, you should be alternating every other day.
A lot of people complain about heel pain. Is that plantar fasciitis, or what is that?
So most of the time, pain on the bottom of the heel is plantar fasciitis, but there are other things like bursitis and stress fractures of the heel bone that can cause that particular problem. If there's pain on the back, it can be an insertional tendinitis from Achilles tendinitis.
What about this thing called Morton's neuroma? We get a lot of questions about that. What can be done about it? What causes it?
So a neuroma is a benign enlargement of a nerve that runs between generally the third and fourth metatarsals, and the nerve supplies your third and fourth toes. So people often will have numbness or tingling. They'll have pain on the ball of the foot. They can feel like they're walking on a rock or a pebble, and it can be like an electrical pain. They're very, very common, and they can be managed most of the time with wide shoes, sometimes orthotics, sometimes a special pad called a metatarsal pad if it's placed appropriately, and cortisone injections. And then surgery can be done on it, but it's a last resort because surgery involves removing the neuroma, which gives you some permanent numbness between the two toes. So you don't want to have the surgery unless you absolutely have to, and you really have failed the actual conservative options.
Well, speaking of conservative options, we've got a question from Karen in Erie, Pennsylvania. Karen, you want to tell us your question, please?
Yes, hello. My question is there anything other than a surgical procedure that can help with a bunion? Is there any type of massage? Is there anything else that you can do for a bunion? It's not painful, and I noticed that a wider shoe does help. But I just wondered if there's anything other than surgery that would help with a bunion.
So there's nothing that will take away your bunion without surgery, but if you can manage your bunion conservatively, wide shoes are good, sometimes padding. Sometimes I'll have people do exercises with their toes to strengthen the muscles in their arch. And it doesn't mean that your bunion's going to go away, but maybe it will slow it down from getting worse. And wearing a pad between your first and second toes, a toe spacer, can actually prevent further drift of the bunion.
Now, I have to be honest with you, Dr. Anderson. Many years ago, I had a pair of boots that I really loved, but they really messed up my feet.
You loved them because of the way they looked, not because of the way they felt.
That's true, too. Terry's so honest. She reveals all my secrets. And I did develop a bunion on my big toe. It's a big lump, basically. Right. And when I gave up those boots and I used really good tennis shoes, it actually, I won't say it's completely disappeared, but it is down about 80%. So can they sometimes go away?
That's probably not truly a bunion then, because a bunion is a shifting of bones. And so maybe it was a bursa or something, some soft tissue injury. Could have been a cyst, a ganglion cyst that really popped out at that area. So, and one other thing about pathology around the base of the big toe, bunions are kind of a lump on the side. Some people will come in and say, I have a bunion, and it's really a lump on the top, which is much more likely hallux rigidus, which is arthritis in the big toe joint. So that can be another thing that people think might be a bunion, and it's not.
Let's talk about ankles. Is there anything that runners, for example, should do to prevent sprained ankles? And what should you do if you do happen to sprain an ankle?
Well, this is relevant because there is a basketball player who happens to play for Duke. His name is Cooper Flagg. He is considered one of the best in the country right now, and we're into March Madness, and everybody's got their fingers crossed. Will Cooper Flagg be able to play because he sprained his ankle?
Well, I think he played last night.
Yes, he did.
And there was actually a UNC player who injured his ankle yesterday, which to me looked like a fracture of the ankle.
Ouch.
We'll see what happens. And hopefully he's okay. But, ankle sprains are tricky. They can be, there's different grades of ankle sprains. So
what is an ankle sprain?
Well, so it's where your ankle twists and you have an injury to the ligaments. So there are different types of ankle sprains. The most common is an inversion injury, meaning your foot twists in and you have pain on the outside of your ankle. And that is something that can be a very minor thing. And generally they can get back out there within a week or so. Or it can be much more major where the ligaments are all interrupted and they need much more aggressive care.
What would aggressive care for a sprained ankle look like?
So it depends. There are some high-level athletes that would have surgery to fix it. But generally speaking, people are in a boot for a while and then they have physical therapy and
okay, so this has changed quite a bit from when I was a teenager. Sprained my ankle falling off a loading dock, and it was actually a pretty bad sprain. So they had me just sort of not walk around a lot for a month or so. Yeah, maybe 6 weeks.
You can really improve your chances if you can get those ligaments to heal by immobilizing it or, and doing range of motion and things like that. But getting it treated can be helpful. The problem with repeated ankle sprains is that people develop what's called lateral ankle instability, meaning they're more prone to more sprains. So after a sprain, I really feel like it's important to see your physical therapist and do proprioceptive exercises, which means where is your body in space, where is your foot, so you're less likely to have a sprain in the future.
We have 1 minute left, so can you give us a couple of your recommendations for preventing foot pain in the first place? We've dealt with a lot of foot pain today on the People's Pharmacy, but how do we prevent it from happening?
So I think probably your biggest weapon is choosing the right shoe for the right activity. You don't, like we talked about, you mentioned pickleball in the opening, we see a lot of pickleball injuries. You have to wear a court shoe when you are on the pickleball court. Do not wear your running shoes. Do not wear anything else, your walking shoes. choosing the right shoe and replacing it frequently is probably your best bet. And if you have foot and ankle pain, don't wait. I mean, I think that the hardest thing is when someone comes in and says, "Oh, it's been bothering me for 8 months or 8 years." And if you go to apma.org and there's a Find a Podiatrist tab, you can find someone in your community that will help you, just to get a hold of things early on, because that makes it so much easier.
Sooner is better. And that is all the time we have today. Thanks to our guest, Dr. Jane Andersen. She is board certified with the American Board of Foot and Ankle Surgery. Dr. Andersen practices at Chapel Hill Foot and Ankle, part of FASMA, Foot and Ankle Specialists of the Mid-Atlantic. In that practice is in Chapel Hill, North Carolina. She specializes in foot and ankle care for children, adults, athletes, and geriatric patients, and is a trustee of the American Podiatric Medical Association. On January 18th, 2025, Dr. Jane Andersen was presented the Edwin B. Martin Jr. Award for Podiatrist of the Year.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with The People's Pharmacy.
Lynn Siegel produced today's show. Pamela Alberta and Ayasi Chinflu provided technical assistance. Al Wadarski engineered. The People's Pharmacy theme music is by B.J. Liederman.
Today's show is number 1423. You can find it online at peoplespharmacy.com. You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. That's where you can share your thoughts about the show. We would be ever so grateful if you wrote a review of the podcast. If you could not get through to share your story, email us, radio@peoplespharmacy.com.
If you go to peoplespharmacy.com, you could sign up for our free online newsletter. It's an easy way to stay on top of breaking health news. By subscribing to our newsletter, you also have regular access to our weekly podcast, and you can find out ahead of time what topics we'll be covering.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you so much for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.